Most women grow up hearing about menopause, the milestone marked by 12 consecutive months without a period. However, far too many are left unprepared for the turbulent, often lengthy years that come before it. This stage is called perimenopause. Perimenopause is the transitional journey toward menopause. During this time, the ovaries begin to slow down their production of estrogen and progesterone, causing these hormone levels to rise and fall in unpredictable, often erratic ways. Because these hormones act as messengers for almost every system in the body, the symptoms can manifest in vastly different ways, from cycles and sleep to mood, weight, skin, hair, memory, bladder, and sexual health. The most confusing part is this: many women do not realize it is perimenopause at all. Maybe I am just stressed. Maybe I am not sleeping enough. Maybe something is wrong with me. But sometimes, your body is not failing you. It is navigating a profound hormonal shift. This video is for educational purposes only and does not replace medical advice, diagnosis, or treatment. If your symptoms are severe, sudden, unusual, or impacting your quality of life, please reach out to a qualified healthcare provider or a gynecologist. 1. Periods may become irregular. One of the earliest and most telling signs of perimenopause is a shift in your menstrual pattern. As ovulation becomes less predictable, your cycle may change. It may come earlier, later, become significantly heavier, or taper off to light spotting. You might skip a month entirely, only to have a heavy flow the next. When to pay attention: while changes are expected, they should not be ignored. If bleeding is exceptionally heavy, soaking through a pad tampon every hour, lasts longer than 7 days, occurs between periods, happens after sexual intercourse, or returns after you have officially reached menopause, contact your doctor immediately. Perimenopause does not automatically equal infertility. If you are still having periods, pregnancy is still a possibility. Always track your cycles as a health metric. 2. Hot flashes and night sweats. Sudden surges of heat, often called hot flashes, are a hallmark of this transition. You may feel a rush of heat in your face, neck, and chest, sometimes accompanied by a rapid heart rate. When this happens at night, it results in drenching night sweats. The struggle is rarely just the heat. It is the disrupted sleep. Poor sleep creates a ripple effect: fatigue, irritability, and cognitive decline the following day. While keeping your room cool and wearing breathable fabrics can help, frequent disruption to your life warrants a conversation with a provider about potential interventions. 3. Sleep may become lighter and less refreshing. Even without the interruption of night sweats, sleep architecture changes during perimenopause. You might find yourself falling asleep only to wake up repeatedly, or find yourself wide awake at 3 a.m. Many women report that they sleep for 8 hours but wake up feeling completely unrefreshed. This chronic sleep deficit can mimic or exacerbate anxiety, depression, and memory lapses. It is vital to prioritize sleep hygiene, consistent schedules, cool temperatures, and limiting caffeine. But if insomnia persists, do not accept it as just how it is now. You deserve restorative rest. 4. Mood changes can feel personal, but they are biological. Perimenopause can significantly impact emotional regulation. You might experience heightened irritability, bouts of anxiety, unexplained sadness, or sudden anger. The hardest part for many is the self-blame. You may ask yourself, why am I reacting this way? Or why do small things bother me so much? Hormonal fluctuations affect the neurotransmitters in your brain that regulate mood. This does not mean your life stresses aren't real. They are, but the nervous system becomes more sensitive during this transition. If your emotional distress, anxiety, or feelings of hopelessness become overwhelming, please seek professional support. You are not going crazy. Your body is asking for extra care. 5. Brain fog affects focus and memory. Brain fog is a common complaint. It manifests as forgetting why you walked into a room, losing words mid-sentence, or feeling like you simply cannot process information as quickly as you once did. This can be frightening, but it is often linked to the combination of hormonal changes and poor sleep. To manage this, utilize external tools like calendars, lists, and reminders. Stay active and keep your brain engaged. However, if these memory lapses start affecting your safety, driving, or work independence, it is time to consult a doctor. 6. Weight, skin, and body aches. Many women notice a shift in body composition, particularly increased weight around the midsection. This can feel deeply frustrating when your diet and exercise routines haven't changed. Muscle mass tends to decrease with age, and hormone shifts influence how our bodies store fat. Furthermore, you may notice joint stiffness, muscle tension, dry or itchy skin, or even adult acne. While these can feel random, hormones regulate inflammation, hydration, and collagen production. Focus on strength training to maintain muscle and prioritize anti-inflammatory, nutrient-dense foods. If you experience severe pain or sudden physical weakness, seek medical evaluation. 7. Vaginal, sexual, and bladder changes. This is the topic most women suffer through in silence. Lower estrogen levels can lead to tissue changes, resulting in vaginal dryness, discomfort during intercourse, and urinary issues like urgency or frequent infections. These symptoms are common, but they are not normal in the sense that you must endure them. They are medical symptoms that have effective treatments. If you are experiencing pain, discomfort, or loss of libido, please speak to your healthcare provider. They discuss these topics every day. You do not have to feel embarrassed. When to see a healthcare provider. If symptoms are affecting your work, relationships, or mental health, seek help. Specifically, consult a professional if you experience very heavy, prolonged, or postmenopausal bleeding, pelvic pain, or pain during intercourse, severe mood swings, anxiety, or depression, frequent urinary tract issues. Perimenopause is a natural physiological process, but natural does not mean you have to suffer in silence. You are not broken, and you are not imagining it. Whether you choose lifestyle adjustments, non-hormonal support, or hormone therapy, there are paths to feeling like yourself again. Track your symptoms, ask questions, and advocate for your health. Because this stage is not the end of feeling like.